January 1945, somewhere in the Ardennes forest. The snow fell in thick curtains across the Belgian countryside, muffling the distant thunder of artillery. In a frozen barn converted into a makeshift aid station, a young Wehrmacht corporal named Franz Becker lay on a stretcher, his leg shattered by shrapnel from an American mortar round. He had been taught that capture meant torture, that the Americans were gangsters in uniform who showed no mercy to the soldiers of the Reich. Through waves of pain, he watched as a medic approached, not with a bayonet or interrogation tools, but with morphine, sulfa powder, and hands that moved with practiced efficiency. The American spoke no German. Becker spoke no English. Yet in that moment, as skilled fingers began to stabilize his wounds with the same care given to the GI on the adjacent cot, something fundamental shifted in the young corporal's understanding of the war he had been fighting. This was not an isolated incident. Across every theater where German forces met American troops, from the deserts of North Africa to the forests of Central Europe, captured Wehrmacht soldiers encountered something their propaganda had never prepared them for. Medical care that made no distinction between friend and enemy, abundance that seemed to flow endlessly even at the front lines, and a philosophical approach to warfare that treated the preservation of life, any life, as a moral imperative rather than a strategic calculation. The experience would prove so jarring, so fundamentally at odds with everything they had been conditioned to expect, that it would shake the ideological foundations many had carried into battle. The German soldier of 1942 marched to war with certain assumptions embedded deep in his training. The National Socialist state had spent years constructing an image of Americans as soft, decadent, racially mongrelized, a nation of shopkeepers and gangsters without the discipline or martial spirit to stand against the Wehrmacht's battle-hardened divisions. German military doctrine emphasized speed, aggression, and the calculated sacrifice of resources, including human ones, to achieve tactical objectives. Medical care in the Wehrmacht, while competent by the standards of the era, operated under severe constraints. Morphine was rationed. Sulfa drugs were precious. Wounded soldiers often received only basic field treatment before being evacuated to rear-area hospitals, and those hospitals themselves struggled with shortages that worsened as the war progressed and supply lines stretched across conquered territories. More fundamentally, the German military operated within an ideological framework that assigned different values to different lives. The racial theories that undergirded the Nazi state created hierarchies of worth that permeated every institution, including the armed forces. Prisoners of war from Eastern Europe faced deliberate starvation and medical neglect. Wounded German soldiers, while generally treated with care, existed within a system that prioritized the collective over the individual, where personal suffering was sublimated to the needs of the state and the continuation of the war effort. The very concept of expending significant resources to preserve the life of an enemy combatant would have seemed not just impractical but ideologically suspect, a kind of weakness that betrayed confusion about the fundamental nature of the struggle being waged. When the first large numbers of German prisoners began flowing into American custody following Operation Torch in North Africa during late 1942 and early 1943, they carried with them expectations shaped by these doctrines and by specific propaganda warnings about American brutality. Many had been told that American soldiers, products of a racially inferior, mongrel society dominated by Jews and criminals, would exact revenge for Germany's military successes. Capture, they were warned, meant beatings, starvation, perhaps execution. Medical care, if it existed at all, would be deliberately withheld as a form of torture. The reality proved so different as to seem almost incomprehensible. Wounded German prisoners arriving at American aid stations discovered themselves receiving the same plasma, the same sulfa powder, the same morphine doses, the same surgical care as wounded American soldiers. The American Medical Corps operated under explicit orders derived from the Geneva Conventions and, more deeply, from a medical ethics tradition that made no distinction between patients based on nationality or allegiance. A sucking chest wound received the same urgent intervention whether it belonged to a corporal from Ohio or a sergeant from Bavaria. A compound fracture required the same careful setting and casting regardless of the uniform the patient had worn hours earlier. This approach was not merely policy, but philosophy made manifest. The United States had entered the war with industrial capacity that allowed it to produce medical supplies in quantities that seemed almost fantastical to soldiers from resource-constrained European nations. American military planners had allocated vast resources to the medical corps, understanding that effective battlefield medicine served both humanitarian and practical purposes. Treated men could potentially fight again, and the promise of competent medical care sustained morale among troops who knew they would not be abandoned if wounded. The result was a logistical pipeline that delivered whole blood and plasma to forward aid stations, that equipped battalion surgeons with instruments and pharmaceuticals in abundance, that maintained mobile surgical hospitals capable of performing complex operations within miles of the front lines. German prisoners witnessed this abundance with something approaching disbelief. Men who had been rationing bandages and morphine in their own units found themselves in American field hospitals where supplies seemed inexhaustible. The psychological impact was profound. A Wehrmacht lieutenant captured during the fighting around Kasserine Pass in Tunisia wrote in a diary later recovered by Allied intelligence, "They treat us better than we treated our own wounded. There is no end to their medicines. They waste morphine on prisoners who by all logic should receive nothing." The word waste carried layers of meaning, simultaneously an observation about resource allocation and an inadvertent confession about the different values embedded in the two military systems. The sulfa powder became a symbol of this divide. American medics distributed the infection-fighting drug with a liberality that shocked German medical personnel. In the Wehrmacht, sulfa, called Prontosil in German military circles, was carefully rationed, reserved for the most serious infections where it might mean the difference between survival and death. American medics sprinkled it into wounds almost casually, understanding that preventing infection cost far less in the long term than treating established sepsis. German prisoners watched this routine prophylaxis with fascination and growing comprehension that they had entered a medical environment operating on entirely different assumptions about the value and availability of resources. But the American approach encompassed more than material abundance. German prisoners noted the attitude of American medical personnel, the matter-of-fact professionalism that treated enemy wounded as patients rather than adversaries. Captured Wehrmacht surgeons, themselves experienced medical officers, observed American surgical techniques and post-operative care with professional appreciation. A German military doctor captured in Sicily in 1943 later wrote in official interrogation, reports that the level of American forward surgical capability exceeded anything he had encountered in 4 years of war. Mobile Army surgical hospitals performed operations under field conditions that Wehrmacht doctrine reserved for base hospitals far behind the lines. The Americans had brought not just supplies, but expertise to the battlefield itself, investing in training and equipping surgical teams capable of working in tents and barns and shattered buildings within sound of the guns. This investment reflected a fundamental philosophical difference about the nature of warfare and the value of human life. The American military, for all its industrial ruthlessness in prosecuting the war, operated within a cultural framework that regarded individual lives as possessing intrinsic worth rather than merely instrumental value. This was not naivete or softness, but a different calculus entirely, one that saw the preservation of life, even enemy life once that enemy had surrendered, as a moral obligation consistent with the democratic values the war ostensibly defended. The Geneva Conventions provided legal framework, but the reality in American aid stations and field hospitals reflected something deeper than legal compliance, a cultural commitment to humanitarian principles that persisted even in the midst of industrial-scale violence. The contrast became especially stark when German prisoners found themselves housed in POW camps on American soil. Beginning in 1943, hundreds of thousands of captured Wehrmacht personnel were shipped across the Atlantic to camps scattered across the continental United States. There they encountered medical facilities that seemed to belong to a different war entirely. Camp hospitals offered dental care, eyeglasses, physical therapy for old wounds. Sick prisoners received the same medications available to American civilians. The Red Cross monitored conditions, but inspectors found that American adherence to the Geneva Conventions often exceeded minimum requirements not from fear of international scrutiny, but from institutional commitment to standards that treated prisoners as human beings entitled to care. A Luftwaffe pilot shot down over Tunisia and eventually transferred to a POW camp in Texas, described in post-war interviews the surreal experience of receiving root canal treatment from an American military dentist who chatted about baseball and weather while working on the teeth of an enemy combatant. The juxtaposition, the clinical precision, the casual conversation, the implication that a prisoner's dental health mattered enough to warrant an hour of a trained dentist's time, encapsulated the broader disconnect between Nazi ideology and American practice. In the worldview the pilot had absorbed through years of National Socialist education, such care represented either weakness or a kind of trap, some incomprehensible trick. The possibility that it reflected genuine commitment to humanitarian principles, grounded in democratic philosophy that recognized universal human dignity, lay outside the conceptual framework he had carried into captivity. Not every American facility operated perfectly. Wartime conditions created inconsistencies, and some camps struggled with overcrowding or supply problems, especially in the early months when the influx of prisoners exceeded prepared capacity. But the overall pattern held. The United States had committed resources to prisoner care on a scale that reflected industrial abundance channeled through humanitarian obligation. Mortality rates among German POWs in American custody remained remarkably low compared to mortality rates in German camps holding Allied prisoners, and catastrophically lower than the death rates among Soviet prisoners in German camps or German prisoners in Soviet custody. The statistics told their own story about divergent approaches to the fundamental value of enemy lives. The medical care extended beyond physical treatment to encompass psychological dimensions that Wehrmacht veterans found equally disorienting. American camp doctors treated psychological trauma, what would later be termed combat stress reaction or PTSD, as a legitimate medical condition deserving of care. German military culture, steeped in stoic ideals and suspicious of psychological complaints as potential cowardice, had largely dismissed such issues as character failures. German prisoners suffering from combat trauma found themselves referred to American psychiatrists who approached their symptoms as treatable conditions rather than moral weaknesses. This too represented a philosophical divide, the American willingness to acknowledge that minds could be wounded as surely as bodies, and that such wounds merited medical intervention rather than judgment. The food that appeared on the tables of POW camps carried its own message about American abundance. German prisoners accustomed to Wehrmacht rations that had grown increasingly meager as the war progressed found themselves eating meals that included meat, fresh vegetables, bread, coffee, sometimes exceeding the caloric intake of German civilians under wartime rationing. The meals were not luxurious, but their adequacy and regularity communicated the vast productive capacity of American agriculture and food processing. A Wehrmacht private captured in Normandy and shipped to a camp in Oklahoma later, recalled the cognitive dissonance of eating better as a prisoner than he had eaten as a soldier in the supposedly victorious German army. The Red Cross parcels, the camp canteens selling candy bars and cigarettes, the medical care that prevented malnutrition and treated diet-related illnesses, all of it demonstrated a material reality fundamentally at odds with propaganda about American weakness and German superiority. As the war progressed and more German soldiers experienced capture and American medical care, word filtered back to Wehrmacht units through the grapevine of letters and repatriated wounded. By 1944, soldiers on the Western Front had begun to develop a realistic understanding that capture by Americans or British forces meant relative safety and adequate medical treatment. This knowledge affected morale and combat behavior in subtle but significant ways. Wehrmacht soldiers facing encirclement or hopeless defensive positions increasingly preferred surrender to Anglo-American forces over capture by Soviet troops, whose treatment of German prisoners reflected the savage reciprocity of the Eastern Front, where both sides had largely abandoned Geneva Convention norms. The choice to surrender to Americans when surrender became inevitable represented a kind of battlefield referendum on comparative treatment of prisoners, a tactical decision informed by medical and humanitarian considerations as much as military ones. The systematic nature of American medical care for enemy wounded carried implications that extended beyond individual acts of treatment. It represented the application of industrial and organizational capacity to humanitarian objectives. The same productive power that manufactured tanks and bombers also produced plasma and sulfa powder in quantities sufficient to treat friend and enemy alike. This abundance was not accidental, but the result of deliberate investment, of a society wealthy enough and organized enough to channel resources toward preserving life, even while simultaneously prosecuting war with industrial ruthlessness. The contradiction was more apparent than real. American military effectiveness derived from the same industrial and organizational capacities that enabled comprehensive medical care. Both reflected the productive power of democratic capitalism mobilized for total war. German prisoners with medical training found themselves particularly struck by the systemic nature of American military medicine. The Wehrmacht Medical Corps, competent and often heroically dedicated, operated within constraints imposed by limited resources and transportation bottlenecks. American military medicine functioned as an integrated system. Forward aid stations connected to mobile surgical hospitals, connected to evacuation hospitals, connected to general hospitals in rear areas, all linked by ambulances and hospital trains, and eventually air evacuation. The system moved patients from point of injury to definitive care, with an efficiency that Wehrmacht doctors recognized as qualitatively different from their own evacuation procedures. An American soldier wounded in combat could expect to be in surgery within hours, in a hospital bed within days. The logistical infrastructure required to make that possible, the vehicles, the fuel, the communications, the trained personnel, demonstrated organizational capacity that German medical officers recognized as fundamentally beyond what their own supply-starved military could achieve by 1944. The morphine syringe became another symbol of American medical abundance and the philosophical approach it represented. The small single-dose morphine injectors distributed to American combat medics, and even to individual soldiers for self-administration, represented a level of pharmaceutical supply and trust in individual judgment that German medical practice did not parallel. Wehrmacht medics rationed morphine carefully, reserving it for the most severe cases. American medics used it liberally for any wound causing significant pain, operating on the principle that pain control itself had medical value beyond merely making patients more comfortable. The syringes that German prisoners received for their wounds represented not just pharmaceutical efficacy, but an approach to medical care that treated suffering as something worthy of aggressive intervention rather than stoic endurance. This philosophical approach extended to prisoner repatriation and exchange. Throughout the war, neutral nations facilitated exchanges of severely wounded POWs, and American authorities adhered to agreements that saw disabled German prisoners repatriated to Germany via neutral Sweden. German prisoners discovered that Americans interpreted the categories for repatriation: permanent disability, severe wounds unlikely to heal sufficiently for further military service, with reasonable flexibility, allowing men to return home who might have been retained under stricter readings of the agreements. This too communicated something about American attitudes toward prisoners and warfare itself: a willingness to treat international humanitarian law not as a minimum to be evaded, but as a framework for decent treatment of enemy combatants who had been removed from combat. The Red Cross played a crucial intermediary role, monitoring camps and facilitating communication, but American compliance with Geneva Convention standards typically exceeded what inspection alone would have required. This reflected partly American cultural sensitivity to international opinion, and partly the influence of military lawyers and medical officers who brought professional ethics into dialogue with military necessity. The result was a prisoner of war system that, while far from perfect, represented a genuine attempt to reconcile the violence of total war with humanitarian obligations toward enemy combatants who had laid down their arms. As Germany itself became a battlefield in 1945, and Wehrmacht soldiers fought among their own cities and towns, the distinction between treatment of prisoners became even more pronounced. German soldiers defending Rhine crossings or fighting delaying actions through Bavarian villages witnessed the advance of American forces, and the medical care Americans provided not only to their own wounded, but to German civilians injured in combat. American medical units treated German refugees, distributed medications to civilian populations, established aid stations that served both military and civilian casualties. The contrast with Soviet forces advancing from the east, whose treatment of German civilians ranged from indifferent to deliberately brutal, could not have been more stark. Wehrmacht soldiers faced with inevitable defeat increasingly sought to surrender to or retreat toward American lines, specifically because of this differential treatment. The transformation in understanding occurred gradually, but fundamentally among those German soldiers who survived to experience American captivity and medical care. Men who had marched to war with National Socialist certainties about racial hierarchies and national destinies found those certainties corroded by the mundane reality of American medics treating German wounds with the same care they gave American casualties. The cognitive dissonance between propaganda and experience created space for doubt, for questioning, for the slow recognition that perhaps the ideological framework they had absorbed was systematically wrong about the nature of the enemy they faced. This recognition did not always translate into explicit rejection of Nazi ideology. Political and military allegiances persisted even in captivity, and many German prisoners maintained support for Germany's war aims while acknowledging American humanity in medical care. But the experience planted seeds of doubt. When the same morphine stopped the same pain whether the patient wore Wehrmacht gray or American olive drab, when the same surgical techniques saved German lives using American supplies and expertise, the racial theories that undergirded Nazi ideology began to seem not just wrong but absurd. The Americans demonstrably possessed discipline, organizational capacity, technological sophistication, and humanitarian commitment, all qualities that Nazi propaganda had insisted existed only in the Aryan peoples of Germany. The sulfa powder, the morphine syrettes, the surgical theaters in tents and barns, the prisoner hospitals that provided dental work and eyeglasses, All of it accumulated into a body of evidence about American industrial capacity and humanitarian values that no amount of propaganda could effectively counter. German soldiers experienced American abundance not as abstraction but as material reality, as the bandages that covered their wounds and the blood plasma that saved their lives. The experience was visceral, immediate, impossible to dismiss as Jewish lies or Allied deception. The medic who stopped your bleeding was demonstrably real, as was the surgeon who set your shattered bone and the orderly who brought regular meals during recovery. In the post-war years, as Germany rebuilt under Allied occupation and former Wehrmacht soldiers returned to civilian life, many carried memories of American medical care that shaped their understanding of the war and its outcome. The experience of capture had revealed not American weakness but American strength, a strength rooted not in martial fanaticism, but in industrial capacity, organizational efficiency, and commitment to humanitarian principles even in the midst of industrial warfare. The medical care they had received as prisoners became for many a symbol of the deeper differences between democratic and fascist approaches to human value, between societies that treated individuals as possessing intrinsic worth and ideology that subordinated individual lives to collective racial destiny. The story of German soldiers' astonishment at American medical care was not fundamentally a story about medicine, but about the clash of value systems made tangible through the treatment of wounded enemies. It revealed the gulf between abundance and scarcity, between humanitarian obligation and ideological selectivity, between a society wealthy enough to treat even its enemies with dignity, and a regime that had sacrificed its moral authority along with its military capacity. In the aid stations of the Ardennes and the POW camps of Texas, in every interaction between German prisoner and American medic, played out a larger truth about the nature of the societies at war, a truth that no amount of propaganda could obscure once German soldiers had experienced it directly, had felt it in the morphine that eased their pain, and seen it in the supplies that seemed to flow endlessly from American abundance. The young corporal, Franz Becker, survived his wounds and American captivity to return to Germany in 1946. He carried in his memory the image of that American medic in the frozen Belgian barn, the hands that had stabilized his shattered leg with practiced care, the morphine that had dulled the agony. In post-war Germany, as the full horror of Nazi crimes emerged, and Germans grappled with questions about their nation's guilt and responsibility, Becker would remember that moment as evidence that the values Americans had claimed to fight for, human dignity, individual worth, humanitarian obligation, were not mere propaganda, but principles they had upheld even for enemy soldiers who had marched to war against them. The memory could not erase what Germany had done or undo the crimes committed in Germany's name, but it stood as testimony that even in total war, even amid industrial violence, the choice remained to treat defeated enemies with humanity rather than vengeance, to see in the wounded soldier an obligation to heal rather than an opportunity for revenge. That choice, replicated thousands of times across the European theater by American medics and doctors who treated German prisoners with the same care they gave their own comrades, revealed more about American power and purpose than any battle victory could demonstrate. It showed that American abundance was not weakness but strength, that humanitarian principles were not naive sentimentality but sustainable values grounded in material capacity and cultural commitment. The sulfa powder sprinkled into German wounds, the plasma transfused into German veins, the surgical skill expended on German casualties, all of it testified to a fundamental truth about the conflict and its outcome. The society that could afford to treat its enemies with such care, that chose to uphold humanitarian obligations even at material cost, possessed advantages that went beyond tanks and aircraft to encompass the deeper resources of moral authority and cultural cohesion that no amount of martial ideology could overcome. In the end, the German soldiers' astonishment at American medical care was astonishment at discovering that propaganda had systematically lied about the fundamental nature of their enemy, had portrayed as weakness what was actually strength, had dismissed as decadence what was actually abundance deployed in service of humanitarian values. The discovery came too late to change the war's outcome, but perhaps not too late to shape its meaning, to demonstrate that even total war need not become total barbarism, that the preservation of human dignity remained possible even amid mechanized slaughter, and that the choice to see in every wounded soldier a human being deserving of care, regardless of the uniform he wore, was not weakness, but the truest expression of the democratic values that had mobilized American power in the first place. That lesson, learned in pain and morphine and sulfa powder across 1,000 aid stations and prison camps, would outlast the war itself and stand as evidence that abundance placed in service of humanitarian obligation represented a kind of power more enduring than any military conquest.